Hi, I'm Maxime Patou, a respiratory physician, and I'm glad to introduce to you Kinan Lucini, who will present you his work on the prognostic value of respiratory muscle metabolic activity as measured with the use of a PET-CT.
PET-CT is widely used in the setting of oncological workups, and this technique is based on the detection of radioactive glucose, which is absorbed by tissues with high metabolic activity, although this is not limited to malignant tumors. For example, muscular hypermetabolism is a frequent finding in PET-CT in patients who exercised before being imaged. We know also that chronic respiratory diseases are associated with an increased respiratory muscle activity, which is compensating for an increased respiratory load. And so we hypothesized that this increased activity could translate as hypermetabolism on PET-CT, which would correlate to lung function impairment in our patients, and that this biomarker could reflect a more fragile respiratory state in our patients with prognostic implications. And so we reviewed PET-CT images from 156 patients who underwent lung cancer surgery in our institution over a 5-year period. These patients were mostly male with a median age of 65. 44% had a pre-existing respiratory disease, mostly COPD. In preoperative pulmonary function tests, the median FEV1 was 84% of predicted value and KCO was 75%, while the median VO2 max was 16.2. The most frequent surgeries were lobectomies with a cancer histology of adenocarcinoma in 2/3 of cases and squamous cell carcinoma in the other third. And respiratory muscle metabolism was measured in the scalene, sternocleidomastoidean, intercostal, and diaphragm muscle groups. And in total, 29% of our patients had respiratory muscle hypermetabolism, which we defined as metabolic activity which was over the 90th centile in any respiratory muscle group. We compared clinical parameters between patients with and without respiratory muscle hypermetabolism, and we found that patients with hypermetabolism had more comorbidities, especially cardiovascular, and also a trend toward a lower VO2 max. However, both groups were similar with regards to cancer characteristics and surgical treatment. Among the different muscle groups, the scalene muscle stood out as their metabolic activity was inversely correlated to FEV1 and also positively correlated to TLC in our patients. And as such, patients with the most severe obstructive disorders and the highest pulmonary distension had the most scalene metabolic activity. In an additional post-hoc analysis, which was limited to patients with COPD, this correlation was even stronger. And finally, after a median follow-up of 21 months, the 1-year mortality was 16% in the hypermetabolic group, while it was 8% in the other group, using a Cox regression model, which included respiratory muscle hypermetabolism, FEV1, and also the Charlson comorbidity score. We found that hypermetabolism was associated with a higher mortality in patients with abnormal FEV1 value.
With our original approach, we have shown that PET-CT may be considered as a tool for assessing respiratory muscle activity and to identify high-risk patients. As PET-CT is widely used for the staging of lung cancer patients, we hope that prospective trial will soon confirm our findings.